There's a reason I tell every man who walks into my office the same thing. Eat her out like an apple. I know that sounds strange, but it's the single best piece of advice I've given in over a decade of practicing men's health. I'm Dr. Emma Blake, and if you've been on this channel for a while, you know I don't sugarcoat things. I talk to women every day about what's actually happening in their bedrooms, and the number one complaint I hear about oral sex is this. It feels like being attacked by a hummingbird. Fast, pointy, frantic, and honestly, painful. Because most men learn technique from exactly the wrong place, and they have no idea that what looks good on camera feels like sandpaper in real life. The Apple method fixes that, completely. But I need to explain why it works first, otherwise you'll do it wrong. I had a patient last year, let's call her Rachel, who was actually in my office for a completely unrelated thing. Yeast infection, super routine. She was wearing these bright yellow Crocs, I remember, because I was staring at them while she talked, thinking, who wears Crocs to a doctor's appointment? Anyway, we're wrapping up, I'm writing her prescription, and she just goes, completely out of nowhere, can I ask you something weird? And then she tells me her husband has been going down on her for 11 years, and she's been faking every single response. 11 years. She didn't cry or anything dramatic. She just said it like she was telling me about traffic on the way over. That flatness was almost worse. She loved him. She didn't want to hurt his feelings, so she performed. And he had no idea he was basically torturing her. He was doing the hummingbird thing. Stiff tongue, rapid flicking. Thinks he's doing a great job because that's what he saw in adult films. What he didn't know is that the industry literally calls those scenes painting the fence. The performer has to keep his head pulled way back so the camera can capture the action, which means he can't actually do anything effective. All he can do is flop his tongue around like he's trying to put out a candle from 6 inches away. The clitoris has roughly 8,000 nerve endings, compressed into a space smaller than a pencil eraser. 8,000. For context, that's every nerve ending in the entire male organ, concentrated into something the size of a pea. When you attack that with rapid-fire flicking, you're not creating pleasure. You're creating sensory overload. You're numbing her out. It's like someone screaming directly into your ear and expecting you to find it romantic. So stop. Just stop. Here's what actually works. The Apple technique. And once you understand this, you'll never go back to whatever you were doing before. Picture yourself biting into a big, ripe apple. When you do that, your lips naturally curl inward to cover your teeth. You create a seal around the bite. Now imagine a drop of juice is about to drip down the side, and you use your tongue to catch it, pulling it into your mouth. That motion, that shape, that's what you're recreating. You place your mouth over her clitoris with your lips curled in to cover your teeth. This creates a seal, almost like a vacuum. And instead of flicking your tongue at her, you're gently sucking, pulling. Think about drinking through a straw. Consistent, rhythmic. This draws blood into the tissue rather than creating friction that rubs it raw. Completely different sensation. And because your teeth are covered, you can apply way more pressure without it ever hurting. That's the key most men miss. They're so scared of using pressure that they barely make contact. But with the Apple technique, pressure becomes pleasure instead of pain. Now, wait, actually, let me back up. You can't just dive in with this. If you go straight for the clitoris without warming her up first, even the Apple technique won't work. You have to wake up the neighborhood before you ring the doorbell. What I tell my patients to tell their partners is this. Work the perimeter first. The inner thighs, the outer labia, the crease where the leg meets the pelvis. Use a broad, flat tongue, not pointed, not stiff. Think less hummingbird, more, actually, let me put it this way. Think about how a cow eats grass. Slow, wide, unhurried. Spend at least 60 seconds there. No cheating. No drifting toward the center because you think she's ready. This does something critical. It stimulates the internal legs of the clitoris, the nerve branches that extend deeper than what you can see. You're priming the whole system. You're letting her body figure out what's coming. Anticipation is half the experience, maybe more. Once she's actually responding, once she's lifting her hips toward you, squirming a little, that's your signal. Now you move to the apple technique. Lips curled, seal created, gentle suction, consistent rhythm. And here's the trick that takes it from good to something she won't forget. Hum. I know it sounds ridiculous, but vibration is vibration. When you create a low, steady hum from the back of your throat while maintaining that suction, you're essentially turning yourself into a vibrator. No batteries required. The physical sensation alone adds a whole new layer. But there's something else happening that matters even more. She hears you. She feels that you're enjoying this. And that sound tells her something words never could. It says you're not enduring this. You're not waiting for it to end. You're actually present. Most women carry a low-grade anxiety during oral sex. They worry about how long it's taking. They worry about smell, about taste, about whether their partner is secretly bored or disgusted. These thoughts are pleasure killers. But when she hears genuine enjoyment from you, that internal monologue quiets down. She stops performing and starts feeling. That's when everything changes. Not because you're rushing her, because you've removed every barrier to her letting go. And speaking of barriers, I swear to God, if one more person asks me about that ice cube trick from TikTok, I'm going to lose it. Putting ice on her clitoris does not heighten sensation. It causes vasoconstriction. You're literally reducing blood flow to the area, the opposite of what you want. I don't know who started that, but I'd like to have words with them. Anyway, the apple technique is the opposite of that nonsense. You're increasing blood flow. You're creating warmth. You're pulling sensation toward the surface instead of numbing it. Now here's where most men still screw it up, even when they've got the mechanics right. They're performing the technique, but internally, they're checking their watch. Thinking, is this working yet? Is she getting close? My jaw's starting to hurt. She feels that. Women are incredibly intuitive. If you're anxious, if you're rushing, if you're waiting for her to orgasm so you can feel like a stud, she feels it as pressure. And nothing shuts down a woman's pleasure faster than the feeling that she needs to hurry up. So you have to actually want to be there. Wait, actually, that's not even the right framing. Let me say it differently. If you view this as something you do for her, you've already lost. When you're eating that apple, don't be clinical. Be ravenous. Be messy. Enjoy the juice. She needs to feel that you crave her, not because you want a gold star for giving her an orgasm, but because you love the taste of her. That raw desire is what makes her feel safe enough to completely let go. Not technique alone. Technique plus presence plus genuine hunger. Now, if circulation is part of the issue, if sensitivity seems diminished or arousal takes forever to build, that's often a blood flow problem. Everything I just described works better when there's healthy vascular response in the tissue. Flow helps with that. It's watermelon extract that supports nitric oxide production, which is how your body actually delivers blood where it needs to go. Links in the description. But the point is, even the apple technique can only do so much if the plumbing isn't working. One more thing. After she finishes, if she's had a clitoral orgasm, that tissue becomes hypersensitive, like painfully so. That's not the time to keep going with the apple technique, hoping for round 2. That's when you switch to internal stimulation, G-spot, A-spot, whatever comes next. But that's for another conversation. Here's your assignment. Next time, 60 seconds on the perimeter with a flat, broad tongue. Then the apple. Lips curled, gentle suction, steady rhythm. Add the hum. And for the love of God, act like you're enjoying yourself. Now go practice.